introduced medical kits for all the ICDA centers in the state and further modified the kits. She's also introduced guidelines for implementing the child protection committees in the villages, the block level, as well as at the ward level. Her care and concern for disadvantaged communities is noteworthy. Ladies and gentlemen, put your hands together in welcoming Dr. Shashi Panja.
Namaskar, good evening. Thank you for this.
Good evening, ma'am. If I may, since you are on our platform, if I can spend just 2 minutes sharing something with you. I've kind of looked at your work and I've admired you since 2015. Of course, you became a minister in the government of Didi in 2013, but it's out of your, very fantastic political qualities, personal qualities, as well as professional qualities that have been noticed by several people that I think you made a mark for yourself as a mass leader. Didi, of course, came with the slogan of Ma Mati Manush, and she explained the meaning of Ma as the mother who always stays with us. But at the same time, I think this Ma, which is embodied in the women of our country, is a very important constituency in West Bengal. So the biggest, I think, act of endorsement to your political acumen is the choice of Didi herself in choosing you as the Women and Child Minister. There are 3.39 crore women voters in the state of West Bengal. There are that constitute 48.5% of the electorate, and the elections are coming next year. And guess which state has the highest number of schemes for the welfare of women? It is West Bengal, and got about 250 schemes. So while we are talking about Kanyashri today and the whole world is acknowledging, your work, madam, came to my notice in 2015 through SKOCH Order of Merit, which was given to Kanyashri. As you know, SKOCH follows an extremely stringent process. We look at only outcomes. We do not look at intentions. In 2015, I think there were early results visible of Kanyashri. It got the Order of Merit recognition. It went on to win several huge honors across the world. It is yet to be conferred India's highest independent honor, which is the SKOCH Award, and we are hoping to correct that very, very soon, hopefully within this year. Now, the focus of your own focus as well as Didi's focus on women is apparent in schemes such as Kanyashri, which everybody knows. That brings me to your human qualities, which I said, the personal qualities that I noticed. There are schemes that you don't talk about, but what you think as a woman and as a person come out very clearly in your projects like waiting huts for pregnant women. I don't think anybody other than somebody who was a practicing doctor and became a minister, and God bless you for that, specifically from the field of gynecology, perhaps. I don't know what is your exact field, but I believe you do deal with fertility issues. Who would have thought of making waiting huts for pregnant women? And I think it's went on to become a national project. Similarly, Rupashri scheme, which is helping out poor girls from poor families, it is giving them some fund transfer when they get married. Under your scheme, we've seen female gender ratio in higher education go up from 42% in 2010 to 47.3% in 2019. So I would say God's blessings be added to your work. And if indeed we know anything about Bengalis, it is the women who are the opinion leaders, hopefully for political decision making within the family as well. And I think your results are going to be very, very visible next year when West Bengal goes to election. So welcome once again. It's wonderful to have you, and I really admire you and your work. So if you would kindly now address us.
Thank you, Chairman Sahab, Mr. Samir Kocher. I would just make a very important correction, and that was that the amount of credit and the honor that you gave me, that all belongs to our Honorable Chief Minister, Mamata Banerjee. In fact, all the projects that you named, and even, first of all, I must appreciate for the extensive research, not only extensive, but in-depth research that you have done. I mean, you have really studied us and the state and its schemes very minutely. I was pleasantly surprised to hear you speak so much in depth about it. But of course, going through previous, records as available on YouTube about SKOCH summits, I have seen that you are a very well-read and a very well-researched person. So thank you, and I would convey all these compliments to our Honorable Chief Minister, because that was the important correction, because when you mentioned about the waiting huts for pregnant women, this again comes under the Department of Health and Family Welfare, where Honorable Chief Minister herself is the the health minister. So our schemes for women are majorly, of course, under our department, but there are many more which are looked after by other departments like health, or maybe panchayat for that matter, even for land and land reforms, because she has always believed in empowerment of women. And we have a state policy for empowerment of women in West Bengal, which dates back to as, for the year 2012. So 2011 when she came to power. In 2012, she launched this policy, which included even political empowerment, because further on after that, this government, through the Legislative Assembly, cleared the 50% reservation of women for political representation in the three tier of panchayats. So as she very honestly believes that political empowerment is also a very important tool for women. And similarly, other social empowerment schemes, some of them do come under our department, and some also, under like Panchayat, where priority is given to women to work in the Manrega schemes. Priority is given to women to be the landholder. When you hand over land holdings, the mutation, the papers, the documents has the name of the eldest female member of the family. So that is the kind of respect and the empowerment that she has handed over to women. Having said that, I also recollect with pride, in fact, from our department, because you have already mentioned it, that Kanyasri was given the SKOCH Gold way back in 2015. It was launched in 2013, and 2015, you were one of the earliest who gave us this award. And of course, after that, as you mentioned, we also got the WSSIS award, and then, of course, the United Nations award, the highest award that Kanyasri has achieved. And of course, this is a scheme which is driven again by Honorable Chief Minister. At every administrative meeting that she conducts in the state, Kanyasri is a place of priority, because she actually examines into the number of girls who are enrolled, because this goes through school education. Girl children enrolled in schools should be enrolled with Kanyasri. So she takes into account all numbers, that there is, that all girl children are enrolled. So that is the empowerment of the girl child which has happened, and it is successfully happening. And the other award that you had given to our department, to one of our schemes, was the Transgender Development Board. And transgenders, of course, were neglected. So that is also, we got a award in 2015. And SKOCH Platinum we got in 2017 for Shishu Alai. Now, Shishu Alai is a word which is actually a Bengali word. But to define it very simply, it is the vibrant Anganwadi centers. The vibrant Anganwadi centers which are handing out ECCE curriculum, the Early Childhood Care and Education curriculum, to our ICDS beneficiaries. That means children under 6 years, that is the 3 to 6 years old. And so ICDS is also something which comes under our department. And the order of merit that you have awarded us today is again for a very innovative practice, and that is the home-based parenting. And our challenge here, we had some challenges with this, because we started this due to COVID. So there are statistics when I mentioned Shishu Alai, those vibrant ECC centers where any kind of education which was imparted to those pre-primary children was at level with any kind of private school, if you really take that as the gold standard. So that was the education which was given. Now, pre-lockdown, or I would say pre-COVID, besides the other ICDS services, it was a very robust service that we were, because our malnutrition dropped to say 6.5%. And in fact, even payment of the children was touching almost, say, 97%. So that was happening very successfully. But the priority for a pre-primary education in this ICDS schools was something that we really took it up. Now, when COVID started, obviously it threw up a major challenge to all. It was a global challenge for everybody. But having said that, the issues most important during COVID times or during lockdown times for any family where the beneficiary was a student or enrolled with the ICDS center, the family was more busy with its livelihood losses or for the poverty or for its hunger, the threat of very depleted income, or for even for that matter, that the threat that the disease may happen to them. So education was kind of something which was just beyond their priority list. Now, we were very worried because when lockdown started, our Honorable Chief Minister, very importantly, because ICDS centers obviously shut down for these children. So these children were supposed to be those who were always, when they attended ICDS, there was this supplementary nutrition program, which is again, a very important part of ICDS scheme and its service. So that was totally off because we offered midday meal in the sense it was hot cooked meal. So it was always nothing take home. It was always, they would come to ICDS center and they would eat absolutely khichdi, or it'll be rice with egg and things like that. Now that had totally stopped. So Honorable Chief Minister said that the dry rations should reach to them. Now during this process, when our frontline workers, that is the Anganwadi workers and the helpers and the supervisors were going to the houses to hand over these dry rations, that was the time that we faced that the children were basically idle, doing nothing, and going through tremendous kind of mental trauma, which they were not able to express because they do not have the language or the vocabulary for that. And for that matter, the restlessness which was under there, which was, that they were going through. And it was so difficult to contain them within their homes because obviously they would always want to be beyond their homes to play, etc., or to be in the outside environment, which was then a ban. Parents were obviously busy with the livelihood loss or whatever other problems that they were having. It's during those stressful times that we thought of this home-based parenting innovative procedure, wherein, of course, I would like to thank UNICEF and its partners who stepped in with us, and we sat and it took us March and April to think about it, and we launched this home-based parenting program on 11th of May 2020. And what we were basically doing, and I mean, it's all there in the project because we've submitted it. What we were basically doing was that our workers were in touch with the families. So when they were handing over those dry rations, they were also collecting their numbers, that is their phone numbers, their mobile numbers, those who had that kind of a smartphone. So we of course, devised a module, the educational module. And this was the important thing was it was not the online version of an ECC kind of a syllabus which was happening in school. It was not that something which was happening in school was being provided to them on. It was something that we were giving, which the parent may have been a first generation learner, would understand, would be able to communicate to the child. So if they had that smartphone, we were handing over audio educational modules, which they just had to play to the children. So there were certain tools, like we had an activity calendar, we had certain audio instructions, we had certain audio and pictorial instructions for the parent, which they would just listen to. Because for all that we know that they may not be, in that sense, educated enough to understand the educational material. But the child was in touch with such kind of material in school, in the ICT school. So that went out as an audio package through those who had smartphones. Now, having done that, we also had in mind that it is not necessary that everybody would be having a smartphone, would be having an internet connectivity. So that is when we started to reach out, and we have been working on it. We've started with community radio. We have community radio here in, the ham radio that you know of in West Bengal. So we tapped that and we started off to access those children who didn't have, whose parents didn't have a smartphone. Then again, we are exploring various channels like Doordarshan, not private channels, but the Doordarshan channel, and the other one that we have been speaking to our district DMs is to exploit the cable TVs, which again is very accessible to our population. So this was started off in phases. Now, when we started on 11th May, the entire module used to go right down up to our supervisors, and then she would transmit it further on to our Anganwadi workers or helpers, whoever had the smartphone, or else there would be WhatsApp group, or else there would be parents or neighbors, the neighborhood concept. The neighbors who had a smartphone would be in that group, and that audio module would reach. So, students would collectively, those children would collectively sit and go through the audio modules. Now, this home-based learning package that we had, we evaluated once in August 2020, and we have say about 1,16,759 Anganwadi centers, which are now presently operational. So we reached out to about this is the 3 to 6 year group. So in August, we reached out to say about 14 lakhs 43,500 children. And just we have collected even the September report, and the coverage has reached out to almost 58.91% of our children. So almost about say 15 lakhs out of a population of about 26 odd lakhs. So this is the reachability. Now, there's a very interesting thing which we have been, which we picked up, was that yes, pandemic will come to an end. So what happens post-pandemic? The sustainability of this, we wish to sustain this. We, of course, through your SKOCH platform, will also hope that the other states would replicate it. That is also an ambition. But post-pandemic, really, the reality of the situation, how many of these children would actually be, again, coming back to our ICDS setup? Because yes, again, when post-pandemic, we expect that their parents are trying to get back to work, or maybe there will be a school drop, there will be dropouts or low attendance, or they may not get back. So again, this audio modules will be available for them on the phone. Of course, we will encourage, because it is our job to get them back to schools. But post-pandemic, I think this would be really helpful, so that the continuity of education is there. It is such a simple audio module that suppose if you devise it for a week, we have every day the child goes through a song or a poem, or and goes through a story and a kind of a physical activity which comes through that audio module. And the best part of it is not expensive. We are not asking for very sophisticated teaching learning materials. It is TLMs, in short, are those which are very much available in my house, in a simple house, in a very garib house, you can say, or outside the house. So it can be stones, big and large, small stones, big stones. It can be bartans, in which we cook, big bartans, small bartans, or it can be dal, masoor dal, the seeds of the masoor dal, or some fruits, or some leaves. It is very interestingly devised. So the best part of it is that the TLMs are not something that you need to acquire for. No special materials are required for this. And again, alongside, keeping in mind the COVID, the disease. So there are instructions on the health, the hygiene, and of course also so that the nutrition is not compromised with. The nutrition is also at the same time, we keep advising them on that. So there were challenges like the language. So we have been able to start it off in the local language, that is Bengali and Hindi. And there is a demand for another few of other languages. We are working on it. But Bengali and Hindi, we have started off. There were other, demands, like the challenges for special children. Special children, for them, again, this audio module is something that they could access, even the parents can access. So that I think was an advantage. One thing which we have really been happy to see parents getting involved once the audio module started getting that impetus. Once it started to gather its importance or maybe the demand, gradually we saw that the parents were starting to get involved. In fact, practicing with them, teaching, learning with them, talking with them, and then we started to see even the grandparents were getting involved. So it was a very happy experience that there was a very a positive engagement and a very stimulating kind of a learning environment which was available there in the house. So this I can go on about it, but we hope that that is why we thought that this was a very innovative thing. We thought that it was something which was doesn't come with a cost. We thought it was so readily available, uh, but again, during COVID times, to reach out to every house was a challenge because of COVID restrictions. But again, we are now in the unlocking period. Now, when we are in the unlocking period, the adults have started to move out, but our ICDS centers still remain shut. So the children are still advised, much as the elderly are advised to be at home. So now it's the very elderly person who's at home and the very younger person who's at home, and they are interacting through this home-based innovative parenting. So it has been very successful. And since Mr. Kocherji, you really spoke about our other schemes like Rupasri. Yes, that is a marriage assistance scheme, which is again implemented through our department, and it is a scheme where there is a marriage and the money involved is 25,000, and that also has a social message. Yes, of course, the money is important, but again, when a person a girl who's applying for the scheme, she has to have a bank account of herself, a single bank account holder. So the banking operations is something that she is getting a knowledge of. Secondly, it's a direct benefit transfer to her and her only. Third, we ensure that the age of the girl who is going to get married is above 18, otherwise she is not within the scheme. And of the boy should be above 21. So there are other social messages in it, and that it is a safe marriage. And we have threats, everybody has this threats of certain marriages masked as, trafficking masked as marriages. So safe marriages is again one very important thing. And of course, you have spoken quite a bit about Kanyasri. And Kanyasri, again, is something that for which, if you roll back, there was a time when neonatal mortality was very high. So when Honorable Chief Minister started to kind of investigate as to why these rates are high, you come across the fact that women who were pregnant were delivering earlier than, even before marriageable age. So that was looked into. And once that came into being and Kanyasri was introduced, Kanyasri also had its criteria, and not very difficult, but that the girl child should be in school. So the enrollment increased, the girl became empowered. She started to say that, no, I will not get married before my, the eligible age, and I'm not interested, I want you to study. So that is the social change which has occurred, for which it is also reflected, besides other steps which have been taken, that the NMR, the neonatal mortality rates, the MMRs have also gone down drastically, and we have a very safe motherhood and a safe, neonate, a healthy neonate. So all collectively, this has been a very successful schemes which have helped the girl child and also the woman in the state. As I said, all credit goes to our Honorable Chief Minister. If there
I
is a political will, if there is a political will of the state, anything can happen. Everything good will happen.
Madam, I'm from North India. We have a saying, Hathi ke paon mein sabka paon. So if, Didi is such a colossus, and it's been her vision on women empowerment, that such a considerable body of work has been done in West Bengal since 2013 on women and child development. And it's my earnest desire that we are able to look at all your work. We look at the incremental improvements you've made. And in this year's state of governance, you are possibly the front runner for that. So if you help us and put all of this together, then it will be a great service
Absolutely.
to the entire country. Thank you for correcting me on the waiting hugs for the pregnant women. I was actually hoping to pay you a personal compliment. So if you would allow me, I'll give you another one, which is, which is entirely yours, and you cannot pass it on to Didi as well. Is that when the COVID struck and the sex workers of Sonagachi were out of work, you made sure they had food.
Yes, we've done that.
That's a great personal quality. No other minister would do that. So,
Thank you. Thank you.
thanks to you for that. So, over to Gulsharan.
Well, that was quite invigorating, quite interesting, and involved. The presentation of not only your work, but in fact the changes that it has brought about on the ground is something absolutely marvelous. So our congratulations to you, ma'am. And with this, we start this year's SKOCH Awards.